Well, welcome back, everyone. Today, we have Debra Moore from Lima Memorial OB/GYN with us today to talk about certified nurse midwives and their role in women's health. So thanks so much for joining us, Debra.
Thanks for having me.
All right. So what exactly is a certified nurse midwife, and how does their role differ from that of a community midwife or an OB/GYN?
Yeah, so a certified nurse midwife is a bachelor prepared nurse who also has gone to graduate school and has a master's in nursing, and they specialize in midwifery. The big difference between a community midwife and us is the certification, and we're licensed through Ohio. There are midwives that do home births, and they're trained to do that type of delivery in that environment. But we have additional training that allows midwifery to be offered in the hospital. So we have that nursing perspective, but also the midwifery philosophy, which is, physiological birth is normal, but we are able to try to predict any kind of changes that can happen in pregnancy, but also in labor. And then we have a team available to take care of that woman and her baby while they're in the hospital. I guess the big difference with the OB, like in our office, we're a multidisciplinary team. So it's nice that when I have a patient who wants a midwife, but they become a little bit more complicated, sometimes gestational hypertension, diabetes. So we collaborate with our physicians and they work well with us.
Debra, that's fascinating. So what is the full scope of care that a certified nurse midwife provides? Is it just prenatal care and deliveries?
No, and that's kind of the misconception that we take care of women, girls actually down to the age of 12 typically is kind of our cutoff. Most of the time that's talking about their body, how it's going to change as they develop. But we do wellness exams, we do birth control counseling, we provide IUD care, Nexplanon. I also have perimenopausal women, menopausal women that come see us. So it's out, we include all of that for women's health.
All right, so could you touch on maybe the benefits of choosing a practice that has CMNS available for childbirth?
Yeah, absolutely. So I love our team that we have here at Memorial. The nurses, we've been working with them for 7 years. The hospital's had nurse midwives employed with them for 7 years. The nurses are really good about doing the spinning babies, which is kind of a way to move and manipulate a woman while they're in labor, so that way they can help get that vaginal delivery that we want. But also the doctors are available in case something were to change and we needed to do a C-section, or if somebody needs help with a vacuum delivery.
Yeah, now, if someone is interested in establishing care with you, and how can they get in touch?
Yeah, so they can call Lima Memorial OB/GYN, the 419-998-8245. And then we have a team of 5 providers, but they can ask or request a specific one. And then we do our best to have them meet everybody if they're pregnant.
All right, well, fantastic. Well, Debra Moore, I want to thank you so much for joining us today. I appreciate it.
Thank you.
All right, well, don't go away because we have more when we return.